know that the risk of hypertension can be caused by this nutrient? Let's take a look at this video. Potassium is a mineral found in many foods. Your body needs potassium for almost everything it does, including proper kidney and heart function, muscle contraction, and nerve transmission. Potassium is absorbed via passive diffusion, primarily in the small intestine. About 9% of ingested potassium is absorbed and used to maintain its normal intracellular and extracellular concentrations. The amount of potassium you need each day depends on your age and sex. Average daily recommended amounts are listed in milligrams. At the age of 0 to 12 months, the need is around 400 to 860 milligrams. Children aged 1 to 8 years range from 2,000 to 2,300 milligrams. In boys aged 9 to 13 years, the need is around 3,000 milligrams and increases to 3,400 in adult, whereas in girls aged 9 to 13 years, the need is around 2,300 milligrams and increases to 2,600 in adulthood. Furthermore, pregnant mom needs start from 2,600 milligrams and decrease slightly to 2,500 when breastfeeding. Potassium is found in many foods. You can get recommended amounts of potassium by eating a variety of foods, including fruits such as dried apricots, prunes, raisins, orange juice, and bananas, vegetables such as acorn squash, potatoes, spinach, tomatoes, and broccoli, lentils, kidney beans, soybeans, and nuts, milk, yogurt, meats, poultry, and fish. Potassium also found in multivitamin and supplements potassium only. Potassium in supplements comes in many different forms. A common form is potassium chloride, but other forms used in supplements are potassium citrate, phosphate, aspartate, bicarbonate, and gluconate. Research has not shown that any form of potassium is better than the others. Most dietary supplements provide only small amounts of potassium, no more than 99 milligrams per serving. This is what will happen if the body lacks potassium. Potassium adequacy can increase blood pressure because of salt sensitivity, increased kidney stone risk, increased bone turnover, and urinary calcium excretion. Severe potassium deficiency can cause hypokalemia, serum potassium level less than about 3.6 millimole per liter. Not only caused by potassium inadequacy, hypokalemia can also occur due to several other causes below. There's 3 stages of hypokalemia. Mild hypokalemia is characterized by constipation, fatigue, malaise, and muscle weakness. Moderate rate to severe hypokalemia can cause polyuria, large volume of dilute urine, encephalopathy in patients with kidney disease, glucose intolerance, muscular paralysis, poor respiration, and cardiac arrhythmias, especially in individuals with underlying heart disease. Severe hypokalemia can be life-threatening because of its effects on muscle contraction and cardiac function. This is what will happen if the body has excess dietary potassium. In people with chronic kidney disease and using certain medications, such as angiotensin-converting enzyme inhibitors or potassium-sparing diuretics, people with type 1 diabetes, congestive heart failure, adrenal insufficiency, or liver disease can cause hyperkalemia. Individuals at risk of hyperkalemia should consult a physician or registered dietitian about appropriate potassium intakes from all sources. And this is what will happen if the body has excess potassium supplement. Potassium supplements can cause minor gastrointestinal side effects. Very high amounts of potassium supplements also can cause acute hyperkalemia even in healthy individuals. And the use of potassium salts in certain medications has been associated with small bowel lesions, causing obstruction, hemorrhage, and perforation. Are you in a group at risk of potassium inadequacy? Let's take a look. These following groups are more likely than others to have poor potassium status. In inflammatory bowel disease, potassium secretion increases, which can lead to poor potassium status. Large doses of laxatives and repeated use of enemas can also cause hypokalemia because they increase losses of potassium in stool. Pica is the persistent eating of non-nutritive substances such as clay. When consumed, clay binds potassium in the gastrointestinal tract, which can increase potassium excretion and lead to hypokalemia. Here's some potassium might play a role in diseases and disorders. Higher potassium intakes, in contrast, may help decrease blood pressure, in part by increasing vasodilation and urinary sodium excretion, which in turn reduces plasma volume. Potassium intakes impair calcium reabsorption within the kidney, increasing urinary calcium excretion and potentially causing hypercalciuria. Potassium is needed for insulin secretion from pancreatic cells. Hypokalemia impairs insulin secretion and could lead to glucose intolerance.